There he is. Hey, Dave.
Oh, how's everybody doing? Good morning.
Good morning. Good morning.
Zach, Devin, we got everybody on?
Yes, sir. Let's start it off.
All right. Thank you all for taking the time to join us this morning for this important discussion about how the coronavirus pandemic has impacted our veterans here in Northeast Ohio. I'm sure we always could be discussing this important topic together in person, but as we continue to navigate this pandemic, it's critical we ensure we're doing everything we can to provide for our nation's heroes with the care and support they need during these challenging times. It goes without saying that after asking service members to risk their lives to protect our country, we have the responsibility to ensure that they have what they need to live healthy, happy, and successful lives when they return home. My father, having been a World War II vet, I know the commitment to fulfilling that responsibility can't waver during times of crisis like this one we're in now. In fact, it probably gets expanded during these type of times. But we need to strengthen our resolve to make sure we provide what we need to provide. That's why I've asked you to join me for this discussion today, because I want to better understand how we can help you in your organizations. I have Devin, who's on the ground with us every day in the mentor office, and Zach, who's my main guy in DC. So you've got they're actually better to talk to than me probably, but they're on the ground all the time on these issues. But I want to make sure everybody was in together about it. And it was important that we get together, and I really did just want to put us together to listen, all of us, so we hear together what we can do in any relief that we have going forward. My dad always used to joke about a couple of things. He'd say, don't talk too long, you're not that smart. And secondly, the good Lord gave you 2 ears and 1 tongue, so he must want you to listen twice as much as you speak. So with that, I'd like to begin by asking Beth if she would, the Associate Director of the VA, who's also been the Incident Commander of Cleveland's VA COVID-19 response. It's Marsh to start us off with an update.
Sure, thank you, and we're delighted to be part of this discussion today. As you know, that we're 5 months into this pandemic response, and the support from your office, community stakeholders, and everybody we work with to take care of veterans in Northeast Ohio has been so tremendous, and the very visible actions by everybody involved to come together to respond to this crisis. But just a few hospital updates. We obviously have continued to provide both emergent and clinically needed care throughout the pandemic response. Initially, as you know, we moved non-emergent care to a virtual platform. But back in May, we started our responsible restart, and we are seeing more patients for face-to-face care as it is clinically indicated. I will tell you that we are seeing both veterans and our clinicians adapting very well to that virtual care modality, and patients are really liking it. So there are some areas and some specialties that we will continue to see an elevated amount of virtual care as life continues and life progresses in this new normal. We have moved to a lot of telephone work for clinic reminders, appointment reminders, just to make sure patients are getting the most up-to-date information. Obviously, we also use heavy reliance on social media and communication with our stakeholders to get that information out as well. At this point, we do not have an anticipated date when we will reopen for volunteers and visitors. We do continue with our visitor restrictions that we have, in large part because of the community spread and community prevalence that we are still seeing in, for sure, Cuyahoga County, but Northeast Ohio in general. So we do monitor that regularly, and once we feel it is safe to relax those restrictions, we certainly will be doing that. On the topic of homelessness, just a couple of notes. We did work with our community partners early in this pandemic response to create a process where veterans who tested positive for COVID-19 or were under a quarantine order could be placed in a hotel for isolation. That process really worked out well. It took stress off veterans, obviously, who were homeless and couldn't be in another means of housing, whether it be a shelter or even some of our other VA programs for homeless veterans. so that's really been a relief for all involved, and it was a great outcome to be able to partner with the community on that. Again, we've done a lot of telephone and outreach with our veterans, even our veterans who had graduated from the homeless case management services, to stay in front of problems and changes that might occur through this pandemic and as a result of COVID-19. I will say we have seen a reduction in our homeless numbers. June was the third consecutive month of decreased inflow of literal homeless veterans. That's the lowest sustained level in several years. I say that as a very positive thing. However, our staff and I know our teams are certainly looking into the future with open eyes. We do have some concerns that, you know, the eviction rates are likely to increase, reduced unemployment benefits and just struggles with employment are likely to continue. So it's something we have a close eye on, because I imagine we will see some stresses in that area over the coming months. Tracy Squire, as always, is our homeless outreach coordinator. Ryan has all of her contact information for if anybody needs something specific for that topic. For mental health care, I actually just talked with our mental health team this morning about how they're progressing. We have resumed to more in-person mental health care when it's clinically appropriate. All of our clinicians have the ability to do that. I would say right now for routine mental health follow-up, they're hovering around probably about the 30% rate for in-person visits. What we've actually seen since March is about an 800% increase in our telemental health visits. What our chief of psychiatry had to share this morning is that both veterans and staff, while they learned the system early in March and we worked out some kind of bandwidth issues nationally within VHA, patients are really liking that platform. And again, my chief of psychiatry said, you know, patients who have had, you know, chronic kind of no-show rates over the years or sometimes even resistance to engage in treatment are becoming more engaged now because they're finding that platform easier to engage in, easier to fit into their daily life. And so he's really hopeful that'll result in positive outcomes for some of those patients who have been tough to engage over the years. We have started increasing our admissions back to residential care. That comes with, you know, a kind of new normal in the residential care setting in the DOM here in Northeast Ohio. We have moved to single rooms only. We still do not do any congregate dining or congregate group treatment. All of that is done virtually. But for patients who really need to be in that residential setting for the best treatment outcome, we are starting to admit more patients back to that level of care. As you know, this pandemic has impacted our veterans. We've enacted a lot of additional mental health support for our veterans, and we also stood up some psychological first aid teams for our staff in the mindset that it's important that we all take care of all of us and each other as we move to beat this response. Our mental health point of contact is Dr. Julie Aronoff, and again, Ryan has her contact information if anybody needs it. Thank you for the ability to provide some opening remarks.
Well, thank you very much for being here. And gentlemen, if you don't mind, we'll move to Michelle. Ladies first. How are you? Got to unmute.
There we
Michelle,
go.
there you go.
I'm well. How are you?
Great, thank you.
Geauga County has, we've actually keeping on basically. Our financial assistance has been down, but it has been down over the past several years. We've kind of made it more accessible to the in-home. People don't have to leave. We're trying to do everything we possibly can to get out to the veteran or the dependent and do claims through our computer system that way. So we're making it ourselves more accessible to them, but still keeping, you know, our distance from people and our own personal protective equipment. As far as medical treatment, we've had no qualms whatsoever with the issues. Matter of fact, most of our veterans are saying that they do like the telehealth much better, especially because we are very rural. We don't have access. We have to drive to Wade Park or Willoughby or even Warren to get the access. So the telehealth really touches base with our people out here in Geauga. Our claims are consistently increased, which is great. Blue Water guys, we're really reaching out to them as much as we possibly can. Going to meetings, still trying to do everything we can to get the word out to that. But everything else has been pretty the same here in Geauga.
Now, have you had any problem with people being able to get onto the internet?
No, we have not. And we also have a computer here in our office. If they do have issues or whatever, we try to make everything accessible. We have a computer when we can go out there to their house and they can, use our Wi-Fi.
Great. John, now that I see you drinking, you're out there in Erie, Pennsylvania, but I know a lot of our friends in Ashtabula happen to come your way. Are you having issues with connectivity? People being able to access the internet?
We have actually had folks, been able to access the internet. In fact, piggybacking on what Beth, discussed and talked about, the prevalence of the virtual care, telephone care as a main modality. In fact, nearly 70% of our care is being delivered with those modalities through My Healthy Vet, and we are actually pretty much at the same level of care as last year in terms of resumption of services. We at the Erie VA cover both Western Ohio, Ashtabula, obviously, and then we have 4 other clinics through Northwest, PA here, Western PA, and so part of Network 4. So we partner very closely with Pittsburgh. We partner very closely with our sister facility in Cleveland. It's been a great path forward. Much appreciate, Congressman, the support of the CARES Act. Tremendous resources to VA. We couldn't possibly deliver the outstanding care without that support. In fact, we've been able to bring on about 40 additional COVID-specific type positions to support the screening efforts, clinical efforts, fill our vacancies for frontline clinical staff, both at our outpatient clinics in Ashtabula, plus at the main facility. The funding we have incident command we do routinely with our network office out of Pittsburgh. So the 9 hospitals gather together daily to go through the operational plans to make sure resources, gowns, gloves, PPE, review of any veterans who have COVID or employees is done daily. The good news is the prevalence rate in at least Western PA at this point in time is, less than 0.05%, so it's low. The community hospitals who are also engaging with the CEOs, presidents at Hammett and Allegheny Health System, we meet weekly, so we're part of that community approach too. They have about 10 or so patients on a given day. They have capacity probably up for a couple hundred. So we don't want to get to that point, but the good thing is that between our resources plus community resources, we're well positioned, so should there be any surges, for COVID. And we were one of the sites that went forward first. I volunteered, based upon our staff's willingness to lower prevalence, to move forward about 5 weeks ago now in terms of resumption of our services. So we have a wide array of services that are available for face-to-face again. We're going to be kicking off back our whole health program. So that's the alternative medicines like the acupuncture, battlefield resources, the chiropractic care, et cetera, coming next week. And we just recently finished up our dental clinic, and that's going to be a brand new facility for our staff and obviously veterans to have services there. So things are going well. We just take it day by day. We're cautiously optimistic, and we continually look at what's happening in the community. But we're well supported, and I think our veterans have adjusted very well, and we keep good communication up with our veterans and stakeholders to make sure that they're in the know and making sure that they get the care when and where they need it.
Well, that's super.
Yeah, I'd be happy to entertain any questions anybody has, but appreciate being able to be here today, Devin and Zach.
Yeah, thank you, John. Thank you so much for coming. How is the Ashtabula CBOC going? Are the operations going as well as they can be right now, or have you guys seen any hiccups?
Yeah, they are going as well as, well as planned. Really follow suit from a virtual care standpoint in terms of that balance of virtual care. Of course, veterans who need to come in, need to walk in, will triage and take care of. But a lot of care is being delivered virtually. Our nurse manager out of the clinic, Jean Burns, also on the call. But I think Jean would say too that things are operational. There's no substantial needs there, and clearly we're communicating daily and knowing of any kind of constraints, barriers may be. But we have a robust amount of testing capability both at our facility. We have the Cepheid platform, which can do same-day testing if and when necessary. We have the drive-through clinics that we have established for our veterans if and when necessary, and they can do the point-of-care testing at the clinic. And we have the resources, PPE available.
Awesome. Thank you.
Mm-hmm.
Is John Wormling, from my friend from Lake County, is he on the screen? He's not on mine, but
I'm here, Congressman. Thanks for having us.
what? Sorry, I missed you the other day. That was a very nice event that you were very kind to send some folks over to.
It was a good write-up in the paper also. I apologize for that, but that is our scheduled day for our meeting, and in-person meetings have been few and far between. So we got to get them in here, of course, by the law when they're scheduled, or it's a lot of rigmarole. So I'd echo Michelle's comments from Geauga County. We're not as rural as Michelle's county, but things have been rolling right along. Our financial assistance is down and claims are up. I do believe there's a correlation between the two. But it seems that during this period, the financial assistance really dropped. We too have capabilities to do everything pretty much online. We streamlined our processes. The day this building closed down, we're at the beck and call, of course, of the county commissioners on what we can do within the building. It's their building. But we had our meeting that day and instituted our emergency procedures for financial assistance to get around any sunshine law violations and so forth. And we were ready to rock and roll. We sent half the staff home for a period of weeks and kept them out of the office. We had been working on a plan over the last few months to pretty much totally update everything electronics wise. So they were able to get into their VA claims files, get into their financial assistance, get into their whatever they needed to from wherever they were in their jammies, eating bonbons on the couch. So, and then they were all jonesing to get back, but they were also the first ones jonesing to get home in the beginning. Everything seems to be working with the clinic out here. They're back up and running, and that is what it is. I think everybody's learning the new normals. And when it comes to that kind of stuff, we had been working for homeless, working with Diane Waite. My assistant executive director, Ginny, handles those issues, and they've been working online for quite a while. So nothing's changed in that regard, and we're still able to help those people out. Haven't seen anything really big on the eviction side of it. Everything seems to be fine. There was a few right up front. Of course, the CARES Act took care of a lot of that. And we haven't heard anything, out on the streets or anything major going on there. I didn't prepare any remarks, so I can always ramble on and on, Dave, but I won't. If there's, I guess one thing I would say is there's been a communication problem between some of the elements of the VA, not medical. Medical, I visited the clinic. They're great. They're doing the best they can in this situation. But we've had people that have been showing up at the federal building for their board of Veterans Appeals hearings, not getting communication. I even tried last minute, couldn't get through to anybody. Ended up down on the building, wandering the 4 floors of the VA, and ran into 4 people on 4 floors. Until I had to go get my PIV card renewed, and then I saw some more people. But that was until the federal police officers found out I was wandering around on the 4th floors and scratched their head and then yanked me out of there. But fortunately, I knew one of them. So for us to jump in the car and drive downtown and be down there at, 8:30 in the morning, wander around, nobody knows what's going on. And then you got to make phone calls. And it's upsetting to the veteran. I'm used to being upset, but, to make a veteran who's been waiting for 6 years for his hearing and he finally gets it, and then only to find out it was canceled. So we've established some setups here now in the county where, for those that were available to do the hearings for, we'll be able to do them right here. We had a department service officer come out to our office on Monday, and the veteran was out here, some technical glitches, but once we get that worked out, we're hoping that that'll work well. And if we have any more glitches there, we'll make sure to let Devin know so he can get on it.
Yes, sir.
Yeah, please, because that's ridiculous. I mean, if you're going to set up the hearing after they've waited that long, if they're going to postpone it or cancel it, then they certainly have a duty to let people know. Well, Ben, how's things out in Ashtabula?
Can you hear me?
Yeah.
Okay. All right. I just wanted to make sure. I was having some audio issues up front. So thank you, Congressman, for having us. I think this is a really good tool that you're using to get some information. Ashtabula County, you're going to, I think, probably hear very similar responses to our operational issues over the past several months with the pandemic. Our financial assistance has been virtually nil. We've had very, very little over the past several months, which could be a good thing. Maybe with a lot of the unemployment and the different stimulus and kickers that are coming out, people just aren't needing it as much. But we've had probably less than $6,000 of financial assistance in the past 4 months. The claims are up. The major issue that I'm having with claims is getting requests from NPRC back. And I don't know, I'm assuming that's probably the case across the board. We've got requests dated back to January that we've gotten nothing back on. When you have 1 year timetable to get your evidence collected and submitted in support of a claim, and you're waiting on a discharge, that's bad. That's bad for business. And so if there's any influence you have in that market, that would probably be a good thing to figure out what the issue is and why we're not getting any response. Otherwise, we've had some mingling with different organizations with the homeless population. We're trying to figure out what I call here in Ashtabula the undocumented veteran population. That's the population that the VA is not tracking, but they are veterans. And some of those fall into a homeless population. And so we've got like Sub-Zero Mission. They're out and boots on the ground in the tent cities. And as they identify veterans, now we have a representative here in Ashtabula for that organization that has tied himself to me so that we can get veterans once he identifies them out in the field, and he'll physically bring them here to us so that we can see what we can do to help them out, get them into the VA healthcare system, identify what their period of service is, see if there's anything we can do for them. But that's going to be one of those cases too, where if we don't have access to their discharge and we're sending a request, we're already in a critical situation, being that they're homeless. So what's the road ahead look like for them if it's going to be 6 months to a year before we see a discharge? That's really it. We're a small office here, and we do a lot of benefits and claims predominantly, but that's about it right now.
Well, great. Thank you very much.
Congressman, if I can interject too, and Ben, if you need any assistance, and I'm sure you're in contact with Mike Ware, our homeless coordinator.
I don't know that I have talked to him.
Okay, then we need to engage because we have a robust program and we do the point-in-time surveys and do housing first for veterans. The goal is, the Maslow hierarchy of need to get folks sheltered and then figure out eligibility, enrollment, and those type of things. So we'll catch up here, and I'm going to put you in contact with our team so that we're part of that robust, important mission of identifying homeless veterans. Thank you.
Thank you.
Well, that's good to hear. Glad to hear you guys connecting the dots together.
I'm still kind of a baby here.
Pardon?
I'm still kind of a baby here. I haven't been here very long, so I'm learning.
Well, you got some old timers here on the call who can help. Never
That's
never
right.
feel
That's
bad about asking and reaching out. Jermaine, how are things at the Legion?
Good morning. Thank you, Congressmember Joyce, for this opportunity to participate representing the American Legion. Again, for the individuals I have not met, my name is Jermaine Ferguson. I'm in the legislative coordinator for the American Legion Department of Ohio. So at the beginning of the pandemic, our post really rallied together to find ways to service our veterans, our members, with our post being shut down. Our national commander, Bill Oxford, initiated what we call a buddy check program, where all of our leaders downloaded rosters of all of our members, and it wasn't a membership call, it was how are you doing, what do you need, how can we serve you call. And that was very beneficial to further support that call. We conducted a virtual training, a virtual QPR, question, persuade, refer training with the Ohio Suicide Prevention Foundation. That way we can equip our members if in case they run into a situation where they need to provide some support, they are just have some additional training and a guide for how they can handle those conversations. Our posts statewide have conducted food drives and with the blood drives, also with the American Red Cross to kind of respond to the urgent need for blood drives. In Cleveland, we do have our department service officers at the federal building. They assist all of our veterans who need, you don't have to be a member of the American Legion if you need help with the appeals claim. They are here to assist you. My understanding, it is an appointment only, and I can send out their information, their phone number and email address if anyone needs that information. Locally, the American Legion area post, in collaboration with the local VFW and residents in Ashtabula, Ohio, conduct the Feed the Vets program, which provides groceries, fresh produce to the area veterans who are in need. Today happens to be Purple Heart Day. So if you know a Purple Heart recipient, definitely reach out to them and show them some love. This week, the American Legion Dewey Howitt Post 103, which is located in Ashtabula, Ohio, support the 4th annual Wounded Warriors in Action Foundation weekend, which from the American Legion's collaboration, they provided a steak dinner and it was a camping and fishing trip. The local American Legion Riders chapter also escorted the Purple Heart recipients through Lakeshore Park. And then they handed out American flags to the spectators and the supporters, and they decorated the overpass of Route 11 with American flags. Again, serving our veterans and promoting Americanism are core pillars of the American Legion. So we're glad to continue doing what we need to do to help our communities throughout this pandemic. Thank you for your time.
Thank you. And Doug, you certainly win the best background. Doug Beckley, you just come off.
Sorry about that. Am I unmuted?
I believe so.
Okay. Thank you very much, Congressman. Doug Beckley with Buckeye Paralyzed Veterans of America. Our members have been experiencing a few problems during this time. First of all, getting PPE. We've had members calling, they couldn't get gloves, they couldn't get masks, they couldn't get wipes. We've been purchasing those and shipping those out. We've worked with our service officers and been checking with the different VAs just to see if there's an issue. Most of those seem to be getting resolved now. The number of calls we're getting for PPE are going down. We've had a lot of our members contacting us. What am I supposed to do if my caregiver gets sick? Because a lot of our members are heavily dependent on caregivers, and we've been working with them. Let us know if your caregiver does get sick. We'll get our national service officer working on those and figure out what we can do with that. We've gone through 2 rounds of gift cards. We contacted all of our members and offered them a gift card to help them to be able to buy through Amazon or Walmart, so they didn't have to go out. The majority of our members have underlying conditions that make them more susceptible to COVID, so we're trying to keep them safe. We've spent almost $50,000 on gift cards so far to help them get food or PPE, whatever they need. We've also been calling all of our members, just we're on the second round of calls, just to say, how are things going? Is there anything we can do to help you? So that's pretty much what we've been doing with the, our members. Our national service officers have been working remotely. I'm not sure if they're back in, we have one at the federal building and one at the VA in Cleveland. I'm not sure if they're back in the office, but they've been working remotely during this pandemic. But thanks for all your support for veterans. Thank you.
Yeah, I mean, appreciate what you're doing now. Excuse me for not knowing, but is most of your work done by referrals from VA, or you're finding the list of people and then reaching out to them and helping them with, access VA or access benefits?
Most of our members are come through Cleveland at some point through the Spinal Cord Injury Center. So that's how we, and then they reach out to us and our service officers when they're in need of anything. So that's how we contact, or that we're in contact with them.
Okay, well, that's great that you were able to do it. I mean, PPE was a big problem for everybody, hospitals, everywhere when this first came on. And you had, you know, I had people coming out of the woodwork about, oh, they got PPE here. And I would tell them the same thing. When you have PPE on the dock here in America somewhere, call me back. Because as we're now starting to find out, there was a lot of people hoping on the IFCOM that they were going to get it here. And there's a lot of contracts that were let without. So Greg Davis, are you online? I don't see on my screen here, but.
Yes, sir, I am. Can everybody hear me?
Yes.
Loud and clear.
Okay, great. Sorry, I don't know, technical difficulties on the viewing, but in any event, so I'm a little unique in this group. I think I am I'm a veteran. I own a skilled home health care and a visiting physician practice. We serve like 16 Northeast Ohio counties. So we provide, just for clarification, skilled home health care where we send nurses and therapists into people's homes to provide a variety of different cares, including therapy and advanced nursing care, wound care, things of that nature. But then a separate business, we also provide medical care, like primary care, medical care with nurse practitioners and physicians. You know, in the unique, well, I think what separates us from the VA health system a little bit in some regards is, you know, we take VA health insurance, but we also take a multitude of others. And quite honestly, about 20% of our patient caseload right now are veterans, so about 80% aren't. But I think there's a lot of common threads between the issues that the veterans are facing and then other elderly that we face as well. I mean, Congressman, you mentioned PPE, and, you know, that was a huge issue in the very beginning for us. You know, we begged, borrowed, stealed, and did whatever we could in the beginning to secure it from a variety of different sources. But it was difficult. I don't think we were necessarily prepared as a country, you know, for the pandemic. But we figured it out, you know, and I think getting to the common thread between a lot of our clients, whether they be veterans or not veterans, is, you know, a lot of the patients, most especially in the beginning, were scared. They didn't know what they were dealing with. In fact, about 25% of our caseload, just for perspective, we have about 600 to 700 Northeast Ohio patients on caseload now, okay? And in the beginning, I would say about 25 to 30% of our patients, whether they be in our home health care side or our visiting physician side, were not cool with us coming in their homes, and understandably, you know, during the beginning of the pandemic. Now, that has certainly let up in the beginning, but it certainly aided in us securing PPE. They felt a lot better about us being gowned up, masked up with gloves and the whole biosuit, so to speak. So that helped. But people had a lot of anxiety in the beginning. And I think what we learned rapidly and I think a lot of the folks from the VA and some of the veteran service coordinators mentioned this, telehealth, telehealth, telehealth. I think that we in America, the technology was there, but I think it's on hyperdrive now, and I think it's a fantastic technology, not only for the age of the pandemic, which hopefully will end soon, but I think beyond that. I think that there is a lot of functionality to it. What we see, whether again it's the veterans that we serve or the other patients we serve, there is a definite access to care issue in the community. You know, whether it be transportation, whether it be a motivation issue. You know, a lot of times patients, you know, for psychiatric need, medical need, you know, can't or don't want to go visit a physician. So I think telephonic and video visits are absolutely an answer for that patient population subset. You know, and one of the limitations that I face, not so much on the side of our visiting physician practice, okay, but there's different billing models between our visiting physician practice and our skilled home health side. So my ask today is, you know, to gain some sort of platform to enlighten awareness that on their skilled home health side, you know, we don't have reimbursement for telehealth or video service yet. And I know Susan Collins in the Senate has put forth legislation to change that, where we would actually have the ability to bill Medicare for telephonic and video services, for telehealth services. So again, you know, it's a powerful model. It's here to stay, and you know, I'd like to talk to some people about it. I really wholeheartedly believe in it. We didn't really do much of it before the pandemic, but I truly, absolutely see the power to go forward. So thank you for the platform, and thank you for the opportunity to speak today.
No problem, Greg. Just think though, who the hell ever heard of Zoom before the middle of March? Now we live on this thing. And you made a good point, you know, and I'm not going to you, in infrastructure in the past, it's always been brought up broadband. And I was like, that's Spectrum and Charter's issue. That's not our issue. You know, we have bridges and roads and other things that need ports that need to be taken care of. But after this, combination of telemedicine and teleeducation are important. And I saw, you know, in along Ashtabula and Trumbull spots that didn't have connectivity, where you go to McDonald's, even though it's only open as a drive-through, all the spots are filled by people using their broadband, and we're having to bring it out to certain locations so kids could get it for download their schoolwork. So I'm in agreement. It's part of what we're going to do, and if we ever get to a COVID relief 6.0 or whatever this next bill is that has been getting kicked around up there in DC while we're all at home. But I think it's a very important part of all this. And we also just did a letter last week to CMS trying to get them, encourage them for having reimbursements for the telehealth. I was glad earlier on here about, as far as I think it might have been Beth that brought up for mental health reasons, how that's been very helpful. You know, any way we can reach out and touch someone, and especially in those mental health conditions, I think it's an important part of what we got to do going forward here. So with that, I see Tim Dibbles on the line. Tim, you want to give us an update? What's going on?
Sure. Thank you, Congressman. Basically, I'll talk to you today. Sorry for the dog barking in the background.
Hey, man, that's what makes Zoom perfect.
But basically, here at DAV Chapter 39 in Ashtabula County, the biggest thing we are dealing with is the inability to have any meetings. So the veterans are not getting that interaction. And that's not just a DAV issue, that's a VSO issue all across the organizations. With that, they are not getting that kind of hands-on chapter service work that they would normally get after the meetings. However, we are doing an aggressive job of referring them to our Ashtabula County Veterans Service Office. Ben and Tom do a great job. You know, all I hear is rave reviews about how our service office is taking care of things through this. We also refer things directly to the Cleveland DAV. I'm not going to talk about the Cleveland office too much because we've got the Cleveland supervisor coming up, Jacob Drost. So I'll leave that to Jake. Another thing that we've been doing is we've really been backing and supporting what you heard about earlier from Jermaine, I believe, was the Ashtabula County Feed Our Vets. They are serving basically a food bank type process and seeing about 160 veteran families per month, providing them food. So that's a fantastic organization. They're in a bit of trouble right now. They're fighting to keep their building. The guy that was allowing them to use this former Red Cross building is he's got an enormous price tag on the building, but they've been holding fundraisers. The veteran service organizations throughout the county have been doing what they could to assist them. So they are working on trying to purchase that building, but you know, they've got a long road to hoe. As far as DAV National, since COVID-19 has kicked in with the quarantine, they've instituted a $250 one-time check for any disabled veteran who has been unemployed due to COVID. So this has really helped out a lot of families. I believe I've got a statistic here that, let's see here. 6,551 applications have been approved nationally for a total of $1.6 million that the DAV has put out to our veterans. So that's been a tremendous help. $250 doesn't sound like a whole lot, but when you have nothing coming in, it goes a long way, and the veterans can use that $250 for whatever they see fit, whether it's groceries or car repairs or whatever. So without stepping on Jake's toes too much, I'll go ahead and close with that, Congressman. I appreciate your forum here today, and looking forward to hearing how things go after this.
Great. Well, slight drum roll right to Jake.
Wonderful. Thanks for having me, Congressman. Good morning, everyone. And unfortunately, Jermaine, I think the Congressman said you had the best background, which I thought I did until I saw Douglas Beckler's background of him with the palm trees in the background there. So I think we both lose here. Nonetheless, Tim had kind of addressed the issue with our national organization and our COVID relief checks of $250. Tim pulled the numbers last night, which I had opportunity to pull them this morning, and the number increased a little bit to 6,538 across the country, many of which those individuals are from the state of Ohio. Now, as many or all of you are aware, the Cleveland regional office, VA regional office, has been closed to the general public, and for all intents and purposes, really closed to all employees with the exception of 2 that work in the mailroom. And those individuals were able to process the mail and get it to the scanning vendor in Janesville, Wisconsin. So because the VA has been closed and we've been working with the skeleton crew here in the Cleveland office, DAV office, the DAV has initiated a call center through the use of Vonage, which allows our service officers to connect with, or for veterans to connect with our service officers to be able to take care of their individual claims work through that specific number. The only thing that's a little bit different about it is normally if a veteran were to call the regional office here in Cleveland, they would talk to a national service officer from our specific office. Currently, we have 65 individuals throughout the country. So if they call that number, they could get a veteran from Ohio could speak to any specific national service officer across the country to get their claims work handled. So I think, just as like everybody else, we've all pretty much had to adapt to it's the new norm, and getting adapt to new media techniques and how to communicate with individuals has been paramount in making sure that our services, whether it's DAV or any service organization or the VA, is able to provide. It's paramount in order to make sure that everybody's being served. So John Wormling, you had stated that there were some issues with the Board of Veterans Appeals hearings. I can't speak for the VA, but I can speak to the information that was passed down this morning. Board of Veterans Appeals hearings have been a major issue. These individuals are waiting years upon years to get these Board of Veterans Appeals hearings. And the building is closed to the public and the VA is not open. However, if they have something in their hand that says they have an appointment here, they are able to come to the building. So veterans have been getting these letters saying, hey, you have an appointment or a hearing scheduled on this date at this time. Please show up. So we've been dealing with a handful of individuals who are showing up for these hearings, and there's no one here to conduct these hearings. So this was a big problem that I've been trying to solve for like probably the last 3 or 4 weeks. So the Board of Veterans Appeals this morning sent out a draft template for the communications they'll be sending any individuals in the future who have Board of Veterans Appeals appointments. So they're going to offer the veteran the opportunity to either postpone their hearing or request what they call a virtual hearing. So the veteran will receive a correspondence from the Department of Veterans Affairs, specifically the Board of Veterans Appeals, at which point the veteran will have the opportunity to call a designated line toward the Board of Veterans Appeals to make that specific election. That was going to be one of the things that I brought up as well, John, this morning, except I got a text about, or excuse me, an email about 2 hours ago stating that this was going to happen. So in the past, the VA was not notifying these veterans that their hearings were either canceled or the regional office was closed. Well, service organizations did their best to notify these veterans that these hearings weren't happening. We do call from a 1-800 number, and it does sometimes appear, or more than likely appears, that we're calling as a solicitor. So in order for us to get a hold of these individuals, we were maybe getting a hold of 20% of individuals who had hearings. And a lot of these individuals, just based on whatever circumstance they were dealing with, elected not to do the virtual hearings and postpone them because of their unfamiliarity with the media platform that the Board of Veterans Appeals was using. But hopefully this is a good fix. I do believe that the Veterans Administration does know that this is an issue, and I think that they're making the correct movements towards correcting it. But we'll see what happens in the near future. But I will say, and I'm not quite sure, but is there a VBA rep on this call or no? For the Cleveland Regional Office in Cleveland?
I don't know. I don't think there is.
No.
Yeah.
So again, I can't speak for them, but I'm pretty in tune with what's going on at the regional office in Cleveland. And it is, and it would be probably advantageous for somebody to reach out to them just to get their full numbers. Last we heard that they were operating at 66% of what they were as far as production on ratings, rating activities and claims. However, that has since increased. I don't know the exact number because now compensation and pension examinations are now available, which is in most cases a requirement to complete a specific claim through the Benefits Administration. So now there's been an uptick in the allowance of VA compensation and pension examinations. We've seen an uptick in the amount of cases that the VA is able to actually promulgate. So, but I mean, so I can't say enough, because we work pretty closely. We work more closely with the Benefits Administration just based on our location, but the opportunity we've had with and the interactions that we've had with the VHA have been absolutely phenomenal. So the VHA has been extremely, extremely open about a VSO partnership that they're very easy to work with them. It's very easy to get things done, and they're very open to listening to the needs that the organizations or stakeholders have for the services they provide for each of the veterans in the specific Northeast Ohio area. With that, I do encourage you to reach out to the service center manager here at the Benefits Administration in Cleveland to give you a more thorough and detailed and correct synopsis of the happenings at the office here. But with that being said, hey, thanks a lot for the opportunity to at least share some of the things that we're doing. You know, everybody's doing a wonderful job. It's nice to see some of the county veteran service officers we haven't seen in quite some time or heard from in quite some time, just because of some of the things that are going on. So it's been great. Other than that, guys, have a wonderful weekend and stay safe.
Thanks. Appreciate the update. Now I want to make sure we get my friend Tim Hickey in. Is Tim on? No? I see Devin shaking his head.
Yeah, Tim bailed last minute, so I'll have to talk to him and give him a hard time later on about that.
Oh, no worries. I mean, Sub-Zero is an important thing. I didn't realize such a thing existed until we had that event over in Mayfield Village. and he
Yeah.
came to the important work that he's doing. Well, look, I hear you, what you're saying, but I want to go back, Jake, what you were saying about the hearings. Then they have a choice of doing the online or virtual hearing. Is that better than the face-to-face? I mean, is there complaints about the virtual hearings?
Well, I will tell you this, and I would probably be willing to bet that some county veteran service officers would probably agree. They may not. Sure, there's a certain calming effect that an in-person hearing has with an individual. But I will say that as the outcome of the specific hearing, as long as the representative's with them and the veteran is prompted and doing the right things, the outcomes of these specific claims, I don't necessarily think would be affected. The outcomes wouldn't be affected by the actual platform. I think it would be more so a comfort issue with the veterans that are holding specific hearings. They've waited a long time to have these hearings, and it is their opportunity and their entitlement to have that hearing and have their time to say why it is they believe they're entitled to benefits sought on appeal. And a lot of them do believe that the face-to-face opportunity does help. And I would probably say many of the veterans that are requesting to postpone their hearings are doing so because they believe the platform is going to be less than advantageous than a face-to-face would be. But I don't think that would specifically be the case, other than a comfort issue for the veterans. The platform the Board of Veterans Appeals is using is perfectly fine.
I just want to make sure that in an impersonal setting, it's easier to cut, to not be as friendly towards the award system. If you're going just by the book or something along those lines. So I was wondering if they're having people.
Yeah,
there.
I think that's a good point. It really is, and I think that probably veterans probably get that same. But again, if it's a hearing that a sworn testimony, Veterans Affairs whose sole duty is to judge the character of that specific testimony, regardless of the platform. So I don't think that necessarily, like I said, possibly the veterans probably having issues with that, but the totality, I would say, has a whole lot of bearing on the specific platform.
Okay.
At least that's my personal opinion. So I can't. That's my personal opinion. That's not a fact, but
no worries. Well, I appreciate all the input from everybody. We're getting close, but I wanted to be able to answer any questions if anybody had one that I've gotten educated certainly during this process. But if any questions as to about what we're at, I'll give you a quick overview. I mean, we got a lot of money out the door after March 13th when our country sort of shut down. And so by 2 weeks later, the 27th, we were put together the first COVID relief. And then have been fine tuning it ever since. And so one of our arguments has been some of the stuff like the PPP programs themselves, if people are asking about them, there's still $140 billion in the program. Yet it has about a week or maybe a week to go before that money is circulated. Main Street lending program, it's ridiculous, like $42 million out of all the billions that were set aside for that lending program that's out there. The economic injury disaster loans is the same type of thing. There's a whole lot of money that hasn't been out. And so before we start appropriating more money, our thought was, close out these programs, make sure people are taken care of, close out those programs, repool and retool that money towards things that are necessary. And certainly those are the things we're going to try to accommodate. And what I've tried to tell like local mayors and county commissioners and such, that this may be, there is some talk about it, like infrastructure, like putting people back to work on things that would work, but also in your own systems, if there's ways that you could collaborate on something that would be very helpful to all of you across the platform. If you come up with ideas like that among yourselves, please feel free to fire them our way, because I do think when people are all coming together and saying this is a good thing, this would be a solution to our headache, it's a hell of a lot easier to sell in DC than just saying we need more money or one-offs. I mean, it's nice to have a plan or a program. Like in telemedicine, obviously, it's a combination of being able to bill for it and making sure that people have access to it. So, those are two big things, but your ideas on how to make that more affordable, the telehearing, let's face it, that's going to have to continue to take place. I mean, I think until we have a vaccine, we're not getting back to normal at any time soon. It looks like, you hear more and more about being mid 21, maybe even late 21 before we're getting back to what we were before March 13th. So I urge you all to think about those type of things, and I'm open for any questions anybody might have.
I have something, Congressman, if you want to some
get a lot of feedback.
I apologize. I'm getting a little sign that says I'm showing a sign that says I have low bandwidth, so I might be breaking up a little bit.
Okay.
You guys got me or no?
That was more clear.
All right, so I'm going to break up a little bit. I believe something's telling me I got low bandwidth, but so something that Congress had passed that was supposed to be implemented last year was the Mission Act, and that was the Caregivers Act. So now the VA is rolling out and saying, okay, we're going to have this by 2021, October of 2021. However, in order to implement the remainder of the Mission Act and specifically the Caregivers Act pre 9/11, they need to make sure the IT infrastructure to implement that plan is up and running by October 21st. Very specific way, any little bit's going to help our veterans. This law is already passed; it's already in act. Now we just need some congressional push to make sure the IT infrastructures are in place to make sure this deadline hits on October of 2021. There's no need for them to wait another year for what's already supposed to have taken place a year ago. So that's all I have. Thanks.
That's a great point. And continue to work on that. Well, I notice I don't want to keep anybody. I realize that we're getting at a 10:58, 10:59. Again, if you have any questions, anything comes up, please feel free to reach out to Zach and Devin or myself at the offices. Joyce.house.gov if those of you might not have the info, but feel free to reach out to us. Again, and as you walk away from this and you think about some of the things that were said here and we talked about, any interaction, anything that we can help lift everybody at one time is great stuff. So please keep me posted on all that. And with that, God bless, have a great weekend and keep up the great work.
You too.
Thank you, Dave.
Yeah.
Thank you.